us now with the dangers of fentanyl and how addictive it is the medical director at Riverside Recovery, Dr. Michael Soar.
Welcome, Doc.
Thank you for having me.
Doc, why is fentanyl such a prevalent drug right now on the streets?
So I think there's multiple reasons for that, and I'll try and address them not in any particular order. The first has to do with the fact that there's no longer as many pill mills out there that there used to be. So people aren't able to get prescription pain medication that were then, misused. So they turn to other things such as heroin because it's a very cheap alternative. However, heroin has a lot of challenges to produce. It takes a long time. You have to grow poppies for about 90 to 100 days, get the morphine from the poppy seeds, then convert it into heroin, which is about 3 to 4 times stronger than morphine. And it then has to be shipped from those areas to the, to at least the United States, along with the rest of the world, where fentanyl can be manufactured in a lab in very little time at very low cost. It's estimated that it takes about $6,000 worth of precursors to make a kilo of fentanyl, and then it's small, very small amount needs to be transported. That 1 kilo that costs $6,000 to manufacture can be sold for about $200,000. So it's just pure economic supply and demand is why it's so popular now.
Yeah, I was wondering why, the fentanyl problem had really soared way past the opioid issue, and that was huge in itself. So what makes it so dangerous? Because it's trending all the time and people are just dying.
Sure, they are. The CDC estimates that there were about just under 100,000 deaths from opioids in 2021. And of those, 70%, over 70,000 folks died from fentanyl. And the answer is pretty simple. It's because fentanyl, the therapeutic dose for fentanyl is in the range of micrograms, so 1/1000th of a gram. When we have a patient that comes into the hospital with a broken hip or having a heart attack and we're giving them pain medication, we give them 100 micrograms of fentanyl, or we give them, say, 4 milligrams of morphine. Those are standard therapeutic safe doses of those medications. Whereas with fentanyl, 2 milligrams is a fatal dose. That's a lethal dose. The therapeutic dose of it is so much lower, and that's one of the reasons why it's so dangerous, because there are not many, drug dealers that are going to package this in safe amounts.
Doc, what are some of the common symptoms and side effects that you've seen from somebody suffering from substance abuse?
So there are symptoms that the patient themselves may have include things like having a preoccupation with obtaining the substance, their substance of choice, getting into trouble with legally, continued use despite adverse effects on their family life, their relationships, legal problems, problems at work, problems at school, and family members may notice changes in their behavior, changes in their personality, the person becoming withdrawn, not paying attention to things that normally were important to them, like hobbies, neglecting personal hygiene. So some of those can mimic mental health issues, but they sometimes go hand in hand, and those are very commonly seen over time.
I know Riverside Recovery really helps people when it comes to the top treatment protocol. So how do you help patients?
So we help them with a multidisciplinary approach, and it really depends what stage they're coming to us in. So if someone is full on in their addiction, is continuing to use, and most people that are using use right before they come to us, they want to get their last hurrah in, right? So we put those folks into detox, and we will give them medications that will help to lessen the withdrawal effects from whatever the substance might be. In the case of opiates like fentanyl, we use a medication called Suboxone that mimics the effects of an opiate. It binds to the same opiate receptor. It decreases the cravings and allows us over a period of about 5 to 7 days to taper that person down and then use other medicines to keep them from, hopefully keep them from wanting to use again.
That's incredible. Dr. Sword, thank you so much for joining us.
Thank you,
You're
Doc.
very welcome.
Yeah. And for more information about Riverside Recovery, visit their website at rrtampa.com. We'll be back with more Bloom Addiction Special right after this.
The preceding portion of Bloom was sponsored by Riverside Recovery.